So ETCTN 10483 is a Phase Ib trial combining Erdafitinib with Enfortumab vedotin in patients who have received prior chemotherapy and checkpoint inhibitor and have FGFR alteration. So the background basically is that EV as a monotherapy has shown a response of around 40% in patients who have received chemo and IO, and similarly Erdafitinib has shown a response of around 45%. So these are very active compound as a single agent. And earlier, when they were approved, they were used as sequential agents when the patient have received chemo and immune therapy. And clinically, the question was which drug to use first and then subsequently. So that led to this trial initiation where can we combine these drugs, also knowing that their toxicities are not overlapping. So EV is more neuropathy and ERDA is more hand-foot diarrhea and mucositis. So that led to the initiation of the trial. There was also some preclinical data suggesting that FGFR inhibitor and chemotherapy can be combined in a synergistic fashion. So in this trial, we have, it's a dose escalation and dose expansion trial. In the dose escalation, we have Erdafitinib at 8 milligram per day, along with EV in a dose escalating pattern starting at 1 milligram per kilogram, giving on day 1, 8, and 15 every 28 days. And then the second dose would be EV at 1.25, which is a standard of care dose. We enrolled initially the first 3 patients. We had 1 DLT, which is grade 3 skin rash. Subsequently, we finished the dose level 1, and then we went to dose level 2. So we enrolled total 9 patients. And what we saw in these 9 patients is the response of, the best response of 100%. So all the patients responded. Out of these 9, 2 patients had skin rash for which they had to come off the trial. So subsequently, when they were off treatment, they progressed. So it was an unconfirmed. But the other 7 out of 9 had a confirmed CR and PR, and we have total 8 PR and 1 CR in this trial. What I'm presenting in the poster is the extended follow-up of over 2 years, and we have a median overall survival of 26 months and a progression-free survival of 10.2 months. In terms of toxicity, what we have seen is that the toxicities are manageable. There is no grade 5 toxicity that we have seen. There was 1 grade 4 skin rash, which was Stevens-Johnson. Otherwise, the toxicities pretty much involve hyperphosphatemia, diarrhea, some mucositis, and some transaminitis, which were all manageable. The dose escalation part is finished. We have a recommended phase 2 dose, which is 1.25 milligrams of EV, along with ERDA at 8 milligram. And right now, the dose escalation is ongoing. We hope to finish the trial soon, and then we can proceed to a larger, bigger trial.